Good morning, everyone. Welcome to MaRS on this early Wednesday morning. My name is Dom Duval. I'm the Vice President of Client Services here at MaRS, and I'll just take 2 seconds for those that are new to our community to give you a brief overview of what we do. MaRS is an innovation center, and our focus is to work with early stage science and technology entrepreneurial ventures and innovative social purpose ventures and help these companies grow. To do so, we provide an array of services, everything from advisory and mentorship, educational programming, market intelligence, connections to capital, and talent services across a multitude of industries. And again, all focused on helping these entrepreneurs identify their challenges and helping them overcome them to expedite job and wealth creation. So today you're in for an exciting morning. This is our second installment of our Market Insights Breakfast series, and the topic couldn't be more timely. The title for today is Consumer Digital Health, Market Opportunities and New Business Models for Industry Stakeholders. And to give you a brief overview as to what to expect today, the focus will be on consumer-centered digital health solutions that are changing the way patients, healthcare providers, pharma, and other related industries interact with one another. And just as a brief overview, if you look at your peers and colleagues around the room, we have representatives from all 3 levels of government: GE, Cisco, TELUS, to name a few of the corporates, many of the law firms, many of the professional services firms, a large group of entrepreneurial ventures, hospital representation from UHN, CAMH, and a multitude of others. So again, a full appreciation of the diverse stakeholders that are interested in this topic. So this breakfast briefing will provide a 360-degree perspective of the consumer digital health industry, bringing together perspectives from a diverse group of individuals and highlight opportunities and challenges for industry stakeholders as they position themselves in the value chain. Today, in particular, we will learn about new business models and the convergence of technologies such as mobile, wireless monitoring, and the web that promise to empower patients and transform the way physicians diagnose, treat, and interact with patients. From a logistical perspective, just to give you some overview of how that's going to go, we are going to have each of the 4 speakers, whom I will briefly introduce momentarily, to spend 10 minutes to provide some insights from their perspective. At 8:50, we will have a panel discussion, which will be facilitated by our 2 moderators. And then we will open it up to the floor for about 15 minutes to take questions from the floor. And then we will conclude sharply by 9:30 to get you on your way. So, as a brief introduction, we have 4 panelists here today. First of all, from Deloitte, we have Michael Matthews, who will talk about how this industry is evolving globally and what are some of the emerging trends. We have Veronica Piasek from Pfizer, who will share their approach and their journey that led to the More Than Medication initiative. We have Sebastian Pervot from TELUS, who will share some thoughts about their new consumer health solutions platform and their view on how healthcare delivery is changing. And we have Sanjay Sharma from Insider Medicine that will share an entrepreneur's perspective on bringing a new technology solution to market. In addition, I would like to introduce to my immediate right, Krista Jones, our practice lead for the Information Technology, Communications, and Entertainment practice here at MaRS, and her co-moderator near the end, Veronica Latinsky, who is the Program Manager of Cognicity, an innovative early-stage venture company, and also part of our Life Sciences and Healthcare Advisory practice. So quickly, I will take the honor of introducing our first speaker, Michael Matthews from Deloitte. And as a brief bio, to give you some insight, Michael is Deloitte's eHealth practice leader and health technology advisor for the health practice. He is a leader in the field of eHealth with over 15 years of experience in the planning, design, implementation, and operation of pragmatic, high-performance eHealth architectures and technology infrastructures. Michael has worked with Canada Health Infoway, Ontario's Ministry of Health and Long-Term Care, Smart Systems for Health Agency, eHealth Ontario, the province of BC, Alberta Health and Wellness, and large health systems in the US. He led Deloitte's Canada's Health 2.0 initiative and was the lead author of Deloitte's Point of View on Personal Health Records. Without any further ado, I'll turn it over to Michael to kick things off. Thank you.
Oops. Thanks very much. Good morning. What I'm going to do to lead in for the other speakers is talk a little bit about our view on digital health. We actually encompass that under more of a productized banner, surprise, surprise, called personal health records. And what I'm going to present, or at least talk to in the time that I have, is a survey that we completed. It's around mid-2009, called our Survey on Consumerism in Healthcare, and point to some of the trends that we got out of that. Unfortunately, we were looking to refresh that right around this time, but I don't have the new stats to be able to underpin this presentation, but a lot of the trends and some of the things that we're seeing are still relevant. So for us, the main problem statement that we see is, right now, and many of you who operate in this industry know this, is we're still very much a paper-based environment. There are early adopters, there is change happening, but more often than not, if you see a physician or some other care provider, you are going to interact with them and have your details documented on paper. Or if there's some kind of a dialogue or exchange of information between you and a care provider, you'll most likely be using a paper-based form, which is unfortunate, but a fact of life. What happens, though, is change is happening, whether it's the health market catching up or whether there's early adopters driving change from within. We are going to see some change, and we're targeting 2020 as being we're going to call it the tipping point date for digital health to actually really start to take root within Canada. What's driving some of this? And for many of you in the marketplace, you've probably heard this, but we see a real change in the dynamics of how healthcare is delivered, really driving that need to have digital health information available and actually within systems and shareable. So many of you know that there is an assault going on in the healthcare industry as a whole in Canada. Where obviously you can't pick up the Globe or any of the other mainstream media pieces and not see some kind of an argument as to why the healthcare system should be changed. Public, private, different models, accountability, you name it. All sorts of different drivers that are forcing us to reevaluate how care and information are exchanged. Other mainstream, I'm going to say, drivers such as chronic disease. There's a push, although many of us don't see it, we do know it, that it's happening. There's a push for additional transparency. And then the cost-price issue. Payers, such as governments, are being put under increased pressure to contain costs because it continues to grow. And then for us, the individual citizens, we're being asked to probably pay more of our share, whether it's delisting of services or other means, where we're starting to actually have to pay for services out of pocket. We're beginning to ask questions as to why we're doing that and what are the cost benefits behind that. This slide more or less encompasses what we pulled out of our 2009 survey. And again, some of the trends are still relevant. We found that overall, when people were posed the question as do they want digital health records, the overall answer is yes. So people do see the benefit. They may not necessarily know what the benefit is, but with computerization and digital information becoming more prevalent in our lives, when people are asked the question, do you want your information electronicized, the resounding answer is yes. We sort of call it the Facebook effect. People don't necessarily understand that they want to actually have access to the information and what they'll do with it, but they understand the point of sharing and the power of being able to have different perspective. I know one of my colleagues from TELUS is probably going to talk about this as well. For us, digital health, and in the context of how we did this survey, we encompassed it under the banner of the personal health record. So briefly put, the personal health record is more of a tool for patients to be able to actually have their own information. Think of it as basically having the patient chart in your hands in a digital form. And it doesn't necessarily have to be on your PC, so physically it doesn't have to reside with you, but instead of it being locked away in a doctor's office in a filing cabinet, you can access it from home, you can access it from other areas, and you can actually participate in how that information is persisted, documented, and you can actually probably go in and correct any sort of inconsistencies or errors you may find. So around PHRs, again, the cost question didn't come into play in the survey, which I know we're going to talk a little bit more in the Q&A. But overall, we see that there is going to be a significant demand driven by patients to be able to actually have access to their information, and that is going to be the real crux for growth in digital health from our perspective. So a bit of a busy slide, but wanted to sort of go through some of the things that we see are going to be important for getting there. We do believe that it'll continue to expand and evolve, digital health. And when we did a forecast and an extrapolation, we saw that 2020 was going to be the tipping day for that. How's that going to happen, and what's going to drive that? We see some fundamental changes in how healthcare is going to be delivered across Canada as being a catalyst for personal health records and digital health. One of the things we're keeping an eye on through our U.S. firm very closely is the buildup of accountable care organizations in the U.S. So if any of you are familiar with those, you know that accountable care organizations are literally going to be the creation of small communities. Of course, there has to be the right size to this accountable care organization. But think of it as a community that's going to be tasked with managing its own care, managing its own healthcare budget. If they do it well and they come in under budget, they can take that money and reinvest it to other programs or to other things that they see fit. If they go over, then they're on the hook to try to fix things and try to get back in line with the budget that they're given. So we actually see that as being a really interesting incubator for being able to actually push the benefits and the business case behind digital health a lot further than it's been so far. We also see too that governments are going to start, we know that governments, meaning the feds and the provinces, are obviously playing a very active role. We have Canada Health Infoway, we have initiatives being done by many of the provinces and territories, but we don't see the pace slowing up. If we ever went through a litmus test, it was the scandals of e-health of a couple of years ago. If that wasn't going to take things off the rails, nothing would. Luckily, we still see continued investment. Infoway has gotten their next batch of funding. We see Ontario and other jurisdictions continuing to invest very heavily in e-health, which is all very good. And they're going to be the ones carrying the banner to make sure that all that information is captured and shared. Patients will want to have ubiquitous access. So we already know that if you can go to any computer and get internet access, you can do your Facebook, you can do your email, you can do other things. We eventually see that patients are going to want to be able to do that with their health information. That's going to become an expectation. We also see that digital health will allow for a better dialogue between patients and their practitioners or care practitioners and providers. That information, whether it's a patient going in, just updating how they're tracking on an exercise, a diet, their blood glucose, whether it's going in and just checking lab results. And again, there's a bit of an interesting caveat to making all the information available in its naked form, but we see this being a very interesting way for a dialogue to start happening. Right now, it's almost unidirectional. You go into your physician office, they read you a lab result, they tell you a little bit about what it means, and then a care plan or some kind of treatment plan gets developed and you go off and do your thing. We see tools such as the PHR and some potential customizations or specific deployments of that being used to be able to actually make that dialogue more sustained, more meaningful, and hopefully a lot better and richer for both sides. And then lastly, there was an interesting study that I recently came across out of Kaiser Permanente out of California, and I don't think they've published this out yet, but they did a quick analysis of some of the data that they have. And for those of you who know Kaiser, you know that it's a large healthcare provider as well as a large payer down in California. And they found that when they looked back at their data, they found that 5 disease states accounted for almost 85% of their expenditures within their payer plan. So when you look at chronic disease and specific disease states, anything that we can use, whether it's digital or otherwise, to be able to hit those and manage them better can have a huge impact on the healthcare system and the growth of healthcare spending. Just my last slide here. So one of the things, though, that we've been keeping our eye on, and we're going to be releasing a couple of new points of view fairly soon around this, is we find that there's going to need to be some change to be able to make sure that digital health actually continues, that it's successful, and we got to believe, we always believe being a techie is, it never goes as far as just the implementation. How do you sustain it beyond the implementation? So one of the things that's going to be pretty important, and we haven't seen this yet in Canada, is we don't know what the overall plan is. So there's opportunity and risk there at the same time. But there's not a strategy that we've seen being put out by Infoway or any of the provinces around PHRs. We've seen a lot of interest, and we've seen motion towards giving patients access, be it through patient portals and other means. But nobody's put out a strategy yet on how you're going to make digital healthcare really change how patient care, funding, and accountability is put in place. The ownership and structure issues. Right now, there's a whole lot of models out there, whether they go down to a specific vendor putting out their name and PHRs in the marketplace, whether it's an insurance plan that's attached to PHR to a specific initiative or program that you can participate in. We haven't seen any clear market-leading ownership structures yet. We're monitoring a couple of them, and we see some promise. But there's not a standout example out there just yet that we can point to. And that goes to the next part, which is funding and sustained. So again, huge opportunity, a lot of interest, a lot of players, but potentially what it looks like now versus what it's going to be 10 years from now is going to be quite different. And we will probably see some consolidation and some breakout players happen in the next little while. And then one of the things that is always talked about with digital health, and there's, if any of you have monitored sort of the health IT media, you've seen that there's been some studies that have come out that have said the benefits around electronic health records and digital health are nowhere near what people thought they were going to be. The interesting thing is we don't, in Canada and a lot of the US, we actually don't know that yet. As much as I'd like to say that some studies done with some small, I'm going to say group health practices, I forget exactly the context, are good, and they point to the fact that we need to be careful. We haven't actually, in places like Ontario, Alberta, we don't have the depth of data, and I'm talking data across multiple years that we can actually really drill deep on to be able to understand how outcomes are linked back to the actual implementation and use of these systems. I think that's going to be a huge opportunity. Everybody talks about BI in healthcare, and it's a huge opportunity, but to be able to make BI happen, you actually have to have the data to drill down on. So we see a huge opportunity there for some other players to come in and secondary markets, be it mobile, be it BI, to support digital health. And that's it.
Great, thank you, Michael. Maybe just before we introduce the next speaker, there's lots of seats up front, so if the people in the back who didn't want to interrupt while somebody was speaking want to take a moment to come and grab some seats, that'd be great, because it's going to be a long hour and a half if you're standing there. So just while you're taking your seats, I'll introduce Veronica. Veronica is the Director of Consumer Communication and Relations at Pfizer Canada. As Pfizer Canada's director, she has been a passionate advocate for wellness, self-care, and building healthier communities. Veronica spearheaded the launch of Pfizer's Canada's acclaimed More Than Medication initiative, which is dedicated to empowering and inspiring Canadians to take charge of their health and actively create healthier, balanced lives. Under the More Than Medication banner, Veronica championed the development of morethanmedication.ca, which has quickly grown to become one of Canada's most popular online health and wellness destinations. Veronica is committed to enhancing self-care in Canada and believes that to be truly healthy, it takes more than medication. Welcome, Veronica.
Thanks. Good morning, everyone. Can you hear me? Yeah? Okay, great. So I just wanted to take you through the More Than Medication story and how we got there and the reason why we did it. So in the early days, or just maybe a few years ago, pharma was seen as big bad pharma, and it was all about pushing the brands. And we saw that the perception out there was really bad, and the trust, not only by consumers, but by all stakeholders, was very low. So we decided, we really have to see what our end consumer wants and needs. So we really constantly ask ourselves, what do consumers want? What do they need? We really listen to them. We try to bring them value, and by doing that, hopefully we're earning their trust. So in the past, there was Pfizer and our reps, and we went to see the doctor, we detailed our products, And basically, the physician then gave information to the patient. Well, the world has changed now, and consumers are going to the internet and empowering themselves with information. They're talking to other consumers about the medications they're taking, and they're getting really experience conversations from other consumers and not just necessarily the physician. In Canada, too, when you look at the internet penetration, it's at 85%. So we're actually one of the highest in the world. We're actually higher than the US at 73%, and then the UK at 66%. So in terms of digital health, Canada is a great country to be in and to do a lot of innovation in. And really, the Web 2.0 is a new health influencer. As I said before, 85% of Canadians are online, 69% are likely to visit a website, and 1 in 4 state that their doctor actually encourages them to look for health information on the internet. And 1 in 5 also agree that they see the doctor less often because they get information on their condition or their symptoms on the internet. So a couple of years ago, too, we looked at our public image. And basically, it was the media that was forming our public image because we weren't talking to consumers about what we do. So really, there was a lot of distrust. There was controversy over direct-to-consumer advertising. There was a lot of stories about the expense of healthcare, drug recalls, the big profits that pharmaceutical companies make, the big payouts, for example, when our pharma executives leave the company, and there was a lot of US media spillover. So consumers had this really bad perception of pharmaceutical companies. So then we wanted to know, what do they think about Pfizer? And what we found out is that a lot of them thought that we were just money-grabbing individuals, and we were all there about profits, and that we didn't care about people. Then the second perception was that it was just a bunch of mad scientists cooking up some potions. So consumers really saw us as only sellers of pills. So we saw a huge opportunity from being in the selling pills business to being really part of the broader healthcare business. I'm not sure if you guys are aware of the book. It's actually really old, called Marketing Myopia. And they talked about basically the downfall of railroads, because railroads and train companies really looked at their business as being the railroad business instead of being in the transportation business. So we really had to look at ourselves. Are we just a pharmaceutical or a drug company, or are we part of the more healthcare industry? So it's a bigger opportunity to be part of the healthcare industry. So then we set out to create more than medication based on consumer needs. And a lot of the needs that were unveiled was that consumers are inundated by information. There's so much information out there, there's pages and pages of it, and they really need bite-sized information that they could incorporate into their daily lives. Also, they need motivation to stay on a good healthcare plan. Then when they're diagnosed with a condition, they feel so guilty, and they need empowerment on what else can they do besides taking their medication. Yes, they have to take their medication, but they want to do other things to stay healthy. So basically what we wanted to do is, first of all, do this with mass media on television to really start to change people's perception that, we're just pill pushers, that we do really believe that it takes more than medication to be healthy, and really we want consumers to look at their overall health and wellness. So those were the ads, but we also had to have some credibility. So we launched morethanmedication.ca, and it's a health and wellness site. I encourage you guys to go visit it. There's no mention of any of our medications. It's purely health and wellness information. So I'll launch the next video, which really explains what it is.
MoreThanMedication.ca, an instructional guide. Pfizer asks Canadians, do you truly feel healthy? We learn that 30% feel stressed out most of the time, 60% say they have too much on their plate, and 34% often plan to start a diet but neglect to follow through. And so it's no wonder why 60% of Canadians agree that they need to take better care of themselves. That's why with morethanmedication.ca, Pfizer is helping Canadians feel and live healthier, more balanced lives. Because to be truly healthy, it takes more than medication. Pfizer's morethanmedication.ca promotes healthy living by providing ideas, tips, and interactive tools on those little things they can do every day to maintain a healthy lifestyle and improve their health. We're helping Canadians by offering information in various areas of well-being that focus on the body, mind, and spirit with not a single mention of medication or advertising. Information is provided by knowledgeable organizations and in consultation with healthcare professionals. Twice weekly, this dynamic website is updated and features new content. So what can be found on morethanmedication.ca? All the content is broken down into topics, the first of which is Eat Better, where Canadians counseled about a healthier diet can learn how to fuel their body for optimal health. Like within all topic areas, Eat Better features related articles about smart and easy ways to eat healthy. Browsing articles is easy. Just click Browse Most Popular and instantly articles sorted by popularity are available. Articles can also be sorted by clicking Newest and Oldest. Here, Canadians can find articles on everything from everyday portion control to healthy eating on a budget to solutions for picky eaters and more. Another topic area is Strengthen Your Mind and Body, tackling physical and mental health. Aside from abundant fitness tips, there are mind-sharpening interactive activities like a Sudoku puzzle to keep the brain active. Where stress and anxiety are affecting overall health, there's the Manage Stress section, offering simple ways to manage anxiety. Got 5 minutes? The 5-minute Stress Buster video teaches how to decompress and clear a cluttered mind. To help Canadians take charge of their own health with their healthcare provider, there's Be in Charge of Your Own Healthcare. Tips, sheets, and tools are available for printout so that they can be better equipped to express issues to their healthcare provider. In the Be Brave section, there's specific advice on how to be strong in the face of life's emotional struggles. Tools such as the audio exercise, Visualize for Inner Strength, can help Canadians find inner strength and overcome uncertainty. And finally, Relate Better gives advice on making the most out of every relationship. From self-esteem to parenting conflict resolution to anger management, interactive self-actualization tools like Full Esteem Ahead is a 21-day guide to improve self-esteem and offers confidence building for many situations. MoreThanMedication.ca also features Find Support, a unique online directory of 10,000 nonprofit Canadian support groups. Contact information is available for everything from diseases and conditions to health and wellness. Canadians can find local support groups to provide them with the support they need. Canadians can also find Smidge on morethanmedication.ca. Smidge is a free, easy-to-use health and wellness app available for download on your iPhone, iTouch, or BlackBerry. Smidge turns little behaviors like taking the stairs, eating fruits and veggies, deep breathing, and more into healthy living habits. By tracking these simple activities, we're helping Canadians improve their health a smidge at a time. MoreThanMedication.ca's bi-monthly e-newsletter highlights key articles and newly added web content that's updated twice a week. Subscribing is a small and easy thing anyone can do to stay healthy. Signing up is simple. All it takes is entering an email address, and Canadians will continually receive ideas, information, and more to help them stay healthy. To experience what this dynamic website has to offer, Canadians can visit morethanmedication.ca and get inspired to live a healthier life. Because to be truly healthy, it takes more than medication.
So that's our More Than Medication initiative, and I just wanted to leave you with the last thought, is that really, in terms of healthcare, we really should be looking at holistic health. It's not just the body, it's really the mind and body connection, and I think that's where, if we're looking at health, we should all be going there. Thank you.
Zach Bamani. He's a Director of Consumer Digital Health at TELUS. As Director of Consumer Health, Zach is responsible for contributing to the product strategy and product marketing activities for TELUS Consumer Health portfolio. And he's also responsible for market and business development. Zach joined TELUS team in 2005 with a focus on wireless solutions for the healthcare vertical. After holding a number of roles within the wireless group at TELUS Business Solutions and following the acquisition of MaRS, Zach has been focused on development of a portfolio of health solutions addressing the needs of consumers.
Thanks very much. One of the perils of following a couple of great speakers is they take all the good content. So I was going to start by talking about some data points, some interesting quotes and stats about how this emergence of consumer health is upon us, but I'm clearly not going to say anything that hasn't already been said. Some of the information out there is very anecdotal, intuitive. Some of it's based on a real research data. There's lots of interpretation over the value and the definition of consumer health, what really consumer health is. But regardless of where the stat comes from, what the stat is, the order of magnitude, it all points to an acknowledgement that there's a very real demand for consumer empowerment, and I think that's at the heart of consumer health. I think there's a lot of still unanswered questions. We have to figure out who the customer is, who the provider is, what they want, probably more importantly, what they need, and how they get it. And TELUS wants to help lead that change. We want to help generate that demand, and we want to be a part of the catalyst that changes the healthcare landscape. And it's not just TELUS, it's not just stakeholders, it's not just providers or entrepreneurs or application providers or vendors that are creating this change. It's consumers themselves. Consumers want this. Many of them are doing this despite the vendor community. Many of them are doing this out of necessity because they need to be able to help themselves. So in some respects, we're catching up to them. Again, these stats are likely outdated, and Veronica's were very compelling. 5 million Canadians searching for online health information actually doesn't sound like a big number. The bottom line is I think any one of us in this room would be pretty hard-pressed to find a friend or a colleague or a family member who hasn't searched for health information online or who doesn't search for health information whenever they've got a question frequently. So consumers are helping themselves. And that's not unique to Canada. We often think that we've got a special set of circumstances in Canada because of our political environment and our social structure. But consumer behavior when it comes to healthcare is pretty common right across the world. And a lot of different countries, a lot of different provider groups have responded. There's a number of different approaches that are being employed, but there's no silver bullet. No one's really solved the problem yet. There's a lot of approaches that have helped the learning. And what that means is that we have to be cautious but experimental and figure out what works for consumers and what works for providers as well. The theme is that there's global momentum, and that's very encouraging. I think it's that momentum that's going to drive usage, that's going to drive valuable solutions, that's going to drive ultimately the business models that I know we'll talk about in the questions period. Whether that's customers that pay, customers being consumers, whether that's a sponsor or a provider, or a combination of both of those, wherever and whoever is deriving the value is going to be in the best position to determine that. But I think that the encouraging note is that there's a lot of activity happening right across the world. And there are lots and lots of players in this industry. So this chart looks busy, and it was meant to talk about Canada, but you could really take out Infoway or Regions or Ministry and sub in some other organization that serves a similar function in just about any environment in North America, and the chart would be relevant. The bottom line is that payers and providers are looking for ways to be more efficient, to be more effective, to help solve the issue of capacity in the system, all the while focusing very much on the quality of care they provide. And that's pushing consumers to the center of the new and emerging delivery model for healthcare. Consumers, on the other hand, are more educated. They're being more proactive. Again, out of necessity, sometimes they're playing a more proactive and meaningful role in their own health and wellness management, and that's putting them at the center of these new emerging models as well. So the forces that are driving the consumer to the middle of this is great, because it's creating opportunity in the solutions that we can provide. It's that change, again, coming back to the theme, it's that change as well in roles that's really going to help drive the business model. So we've talked a lot about the emergence of the need and the ask for consumer health solutions, but we haven't talked too much yet about what those solutions are. And I think there's two key elements to ultimately what will become a very big portfolio of solutions in the market. The first, to me, is table stakes. It's very foundational. It's as Michael mentioned, it's the ability for us to be able to view our own health information, a personal health record, or the facility to do that, a consumer health platform. And what that'll allow us to do is not only just look at our health information, but make more informed decisions, ask better questions, know what's coming before it comes. And it actually creates the foundation for us to start to customize our experiences with the healthcare system and with the tools that we're ultimately be offered. Without having access to information, we really can't take care of ourselves. We will struggle even to follow a care plan unless we have access to the information on which that care plan was built. So that's foundational, just being able to have our information in a private and secure place. The other more exciting part of it is the emergence of a number of applications, tools, devices that are going to allow us to individually customize how we interact with that data. So a patient suffering with diabetes may choose to use a glucometer and an application that helps them track their blood sugar levels. Someone with hypertension may choose to use a blood pressure cuff that allows them to track their hypertension and identify trigger points so that they can change their behaviors before they get to a critical or an emergent situation. And if you're not sick, you may choose to be managing your diet proactively, or have a chip in your running shoe that helps you track your runs or your exercise, or whatever your specific area of interest is. The innovation, the foundation of having our information is table stakes, like I said. The real innovation is going to come from this ecosystem of applications, tools, and devices that are going to allow us to customize that experience. Both of those elements are really going to be critical to our to supporting this evolutionary change. I think I'm missing a slide, but that's okay. That's where TELUS actually is coming to the table. That's where we're putting a lot of our investment. I got the time sign. In the TELUS Health Space, powered by Microsoft Health Vault, is that foundation. It's an ability to, and it's our vision to be able to provide a facility for Canadians to collect, store, manage, share, if they want, their personal health information in a secure and private manner. It's pan-Canadian. We want this to be right across the country, and it's open to the extent where we want to invite those third-party application providers to integrate their solutions with the platform, so that there is a lot of choice, so that there is a portfolio of options, so that individuals can customize their interaction with technology and with the system. And what this should lead to, ideally, is a more informed, a more proactive patient and consumer. It'll hopefully lead to more efficient and effective interactions with the healthcare system and with their physicians or providers. ultimately better decision making, and ideally more capacity, because people who don't need the system aren't using the system, they're helping themselves. So in summary, the role of the consumer is changing. Consumers are already central to their own care. Solutions are already here, they're available, consumers are using them with or without us, and they want them, and in some cases they're willing to pay for them. It's a global theme, which means it's happening right across the world, which means only good things will happen from an evolutionary perspective of the solutions that hit our market. And TELUS is investing big here. We really think that this is key to transforming healthcare in Canada, and we want to be a part of that transformation. Thanks.
Our next speaker is Sanjay Sharma, the Chief Executive Officer of Insider Medicine. Sanjay, who has a lot of initials after his name, is the creator and CEO of Insider Medicine, a leading physician-led news and patient education network. Insider Medicine has created over 4,000 videos and creates 10 minutes of original, evidence-based medical programming each day that reaches over 150,000 patients per month. Its award-winning content is disseminated online through partnerships with Google News, the NIH's Medline Plus, and Insider Medicine TV, an IPTV network that is now playing in many Canadian hospitals and medical offices. A professor of ophthalmology and epidemiology at Queen's University, Dr. Sharma is the author of over 200 articles that appear in the peer-reviewed literature and the American Medical Association's textbook, Evidence-Based to Value-Based Medicine. Welcome, Sharma.
Great, thank you. Can I start with the first slide, please? Thank you. So, I'm Sanjay Sharma. I wear a few different hats: professor of eye surgery and clinical epidemiology at Queen's University. I'm also the founder and editor-in-chief of Insider Medicine. I'm sure a lot of you are asking, why is an eye surgeon creating a news channel? And I'm hoping to take you through exactly how Insider Medicine started and take you through our approach to two things: content and our distribution platforms. So as a physician, probably about 7 or 8 years ago, I started to see a lot of people coming in with files. And they had downloaded information from the internet, which was either factually incorrect, or it was good material, but they didn't know how to act on that material. And so we said to ourselves, is there a better way? And I was inspired about 4 years ago by a video blog, Rocket Boom, out of New York City, to say, can we create a video blog in video format on a daily basis? And like, you know, for the budding entrepreneurs out there, the people you have to turn to when you've got an idea to actually see it into a reality is family and friends. So I turned to my wife, who's a physician. I said, okay, you draw the short end of the stick. So my wife became the on-air personality. I became the person behind the scenes. We had a young family at the time, and we'd film this literally. You know, I'd write the script at 10 o'clock at night. My wife would memorize it, we'd film, we'd be doing compression, and the uploading would be about 3 o'clock in the morning. But we fulfilled the first criteria, that we could get video content done in a daily basis, and we could get it up online. Now, you know, for the sanctity of our marriage, we figured the next thing is we have to scale. I'll get you to play this video for me. So I'm happy to say now I'm still married, and Insider Medicine has now grown to 15 people who are working on this full time. Actually, you can just mute the video. So part of our business is going out to medical conferences, covering medical information as it breaks. We then have 10 minutes of original programming that we do per day. So we do this in a news-related facility. We also have 3D animators that are really graphically assisting us in telling the story. We also leverage our animation database and our assets onto emerging platforms, and there's certainly a business around that. We've also are in the hardware business and software business, so we've created an IPTV platform now that we're taking out to doctors' offices and hospitals across the country. And obviously, there's emerging platforms, whether it's iPads or whether it's the iPhones, that can connect us to patients. So that's really our emerging distribution channel. So evidence-based medicine is a physician-led news and knowledge translation organization. So our point of differentiation is that we're a group of physicians who are creating this voice. The second form of differentiation is the way that we're approaching the distribution. And I say that we're trying to reach patients at the point that they need the information, at a place that they're going to get the information. And so we're really trying to create a milieu where a patient is coming in to see someone, and right at that point in time, they can access our IPTV network or an iPad platform where there's a digital informed consent that's being done. So we were established in 2006. The way that we've built this is I come from an academic background and as a clinician scientist, and this is a peer-reviewed process. So much like a peer-reviewed journal, we have an editorial board, and we carefully select exactly what we're going to cover. We work through an embargoed system with a number of leading journals, JAMA, New England Journal of Medicine, and right now our folks are working on stories that are going to come out in a couple of weeks. We've created content with over 100 different universities, Harvard, Stanford, the CDC. And we've luckily been acknowledged through a number of public service and media awards. So there's two core parts to our business: the content or feed business and the distribution business. So where we exist on the continuum, the way I look at it is something breaks in a researcher's laboratory, whether it's benchtop research, whether it's a randomized clinical trial, then the PR agencies or some form of a megaphone pushes that message out, and then reporters pick that up and translate that even further. On that continuum, insider medicine exists much closer to the researchers, and that's the way we've built our organization. So typically, we actually look at data, look at manuscripts, and start to develop the message in a visually driven medium. And then we take that out online through a variety of distribution channels, use search engine optimization, Google News, those sorts of things to try to drive the stories further. And this is our partnership. So we work with a variety of different channels, whether it's third-party sources that wrap advertisings around it, obviously the typical social media networks, YouTube and Facebook. We also have a partnership with Medline Plus and the NIH. We're now over 200,000 views per month on Insider Medicine. Our IPTV network is getting to over 20,000 patients per month. Our YouTube channel is over 1 million channel views now, and so collectively per year we're over 3 million views. So Insider Medicine TV is the platform that we're starting to scale in hospitals and doctors' offices, and this is customizable channels. So you'll see content in a cardiology clinic that talks about angioplasty, that talks about how to reduce LDL or increase HDL. In an ophthalmology clinic, it'll be about cataract surgery, it'll be about intravitreal injections, as the patients are getting these procedures or learning about these procedures. We've also spent a lot of time becoming iPad developers, and we're leveraging, particularly for informed consent, around interventions, and we'll be launching this in 3 countries in Europe shortly. So I'm going to walk you through just a couple of ways that we actually help people. So Lucentis is a medication that's used for, delivered in the eye for diabetic problems, potentially $1 billion market. They came to us to actually create video content and drive this across multiple platforms. So we created a high quality video with a lot of 3D animation. Within 6 minutes of posting, Google News picked up our story. We had over 15,000 views, over 16,000 views on our IPTV network. In terms of search, if someone typed in Lucentis video, it came up as #1, and certainly people were quite interested with those results. Second case study was with the Canadian Medical Association. CMAJ came to us with a very specific study, the OPAL study, and they wanted to increase the online brand of CMAJ. So we created a video for patients, one for physicians, had over 22,000 views. In terms of Google search, it was terrific. And YouTube to this day, if you actually put in CMAJ, these videos come back quite highly. So Insider Medicine is something that we've created that really is focused on evidence-based medicine. That's our position in the marketplace. We're focused more towards the clinician scientist side, and we've really invested heavily in partnerships where knowledge is created and where patients are being seen. We're leveraging emerging distribution channels as well as creating our own. And in terms of business models, I think the business model is really predicated on the type of distribution channel that you're looking to exploit. Thank you.
Well, thank you. We're now diving into the panel discussion. It's quite obvious, I think, from the presentation so far that there is a hunger for information, there is demand, there is content generated by multiple sources and providers. There are companies that are in the business of assuring access and distribution to this information. And I think it's also obvious that the whole healthcare delivery is going through a paradigm shift. So the ecosystem is changing. And the big question for me as an entrepreneur and investor is who is going to pay for all those interesting things? So I'd like to explore with all our panelists what are the emerging business models. And we started to articulate the value created by digital health solutions. Some of them optimize delivery of healthcare. Some of them make consumers more informed and help them to comply with the therapies. I'd like to hear from all panelists about how they see what is ultimately the value to humanity, if you wish, that they're delivering with their products and what emerging business models they see in this high-growing sector. Maybe Veronica, you would like to start?
Well, I think for any business, if the end goal is better health outcomes, I'm sure that that could increase business and bring revenue. Better health outcomes means consumers or patients would be more compliant with their medication. They would feel better. The physician would be happier because they would stay on their regimen and he would see progress. So that's one of the things. With regards to government, if consumers are more empowered and they take better care of their health, there's probably a lowering in healthcare costs. I think one of the key things, though, and some of the data that we saw this morning with regards to health records, I think the main thing is really consumer acceptance and awareness of the benefits of having these digital solutions. I think Canada is probably, as we saw before, we're digitally connected, but I think as we saw in the earlier days, people were scared to put their credit card number when they were online shopping. So maybe having all this health information, they're scared about that too. And I think as different industries, we need to educate the public on that. For example, there's so many errors that are made just from prescriptions being written and the pharmacist can't read the prescription, or even if a prescription is changed. If a physician was able to enter a prescription digitally, then there wouldn't be any errors. Then side effects or drug-drug interactions could right away pop up and the physician could see those right away. So I think there's a lot of solutions that are out there and the consumer just needs to know what are the benefits to them. And the benefits to them is that they would be taking the right medication, they would know about if there's any drug interactions or what to expect. And I think it's all about the end goal is better health outcomes.
Well, so in Canada and in most of the world, healthcare is paid for by the government. And information on the net is also free. So I know that probably half of the room here are entrepreneurs who are looking to build profitable businesses, and they're probably pitching to their investors how they're going to grow into large companies. Where this extra cash will come from, how the ecosystem will be reconfigured. I'd be interested in, Zach, your views, how you see the world from TELUS's perspective.
Thanks. I think that in Canada we're a bit of an entitled society. To your point, we don't expect to pay for healthcare related services. I think it's ironic because many of us wouldn't hesitate to pay $85 for an hour of a personal trainer's time, but we wouldn't pay $10 or $15 a month to be monitored for a chronic condition that could seriously impact our overall health and our livelihood. So we're in a unique situation in Canada. I think at the end of the day, I think this is a very nascent market and a whole bunch of different business models will emerge. I think we have to approach them cautiously, and I think we need to try a few different things and see what works. Ultimately, I think it's whoever derives the value is going to pay for it or some portion thereof, and there's a lot of stakeholders in all of our healthcare that are getting value out of some of these solutions. I don't think there's any question that the business case exists. So to Veronica's point around e-prescribing, I mean, just avoidance of medication errors, on that premise alone, I think the business case exists, but that still doesn't define who's going to pay for it. I think that some of the models that are emerging will be very traditional, direct to consumer. If I want to use a service, I'll pay for it myself. But there are, like I said, other stakeholders in the environment that are benefiting, whether it's a jurisdiction from better health outcomes, whether it's a doctor or a hospital from increased capacity, whether it's the family members or the patient themselves from just better health. So I think at the end of the day there will be probably a combination of many of those business models. Whether it's direct to consumer and the consumer pays, or the sponsor or the public payer, and they share the cost. I think that there's a number of different options that will emerge.
So, Zach, in your presentation, you had an interesting stat about consumers in the U.S. and where they're accessing information through, whether it's a health record. And you had a stat that showed that 50% of the consumers that were accessing information online were doing it through a payer site. So if you take that analogy into Canada, the payer in Canada is the government. So it was an interesting, there's an interesting corollary there in terms of the business model for Canada. And do you think it really will? And maybe this is actually interesting from Sanjay's perspective, who's providing information. I mean, from the news is interesting. Do you think that it will transition from government and the expectation in Canada that it's government who pays to the consumer wanting and driving enough value?
Yeah, those are all great questions or comments. I do see the government playing an increasingly important role, and I say that partially because of just the regulatory muscle that government traditionally has, and so I think it'll be driven partly on the economics, partly on the outcome side, but partly on the regulatory side. Do I think that there's an appetite and a movement for government to do such a thing? I really do, and I think for the budding entrepreneurs out there, the way you really want to pitch it if you're talking to government is trying to solve a pain. So, you look at things like the H1N1 crisis. So if you can come up with a solution that's driven around content to reduce, some potential epidemic that's emerging, I think your success, your rates of success of adoption will be much higher.
Michael?
I have an interesting view on it, and healthcare is at least in Canada, it's interesting because we have a single payer system, huge opportunity, but unfortunately not very agile. So where I think things are going to go is we have a system, and many of the benefits that anchor digital health information are usually cost avoidance benefits. So we have an opportunity, if we continue along this route, to be able to have an impact by whether it's adverse events, duplication of services, to actually free up capacity within the system, which is a great thing. At one point, you're going to have to, and this is where I think things will get interesting and some of the breakouts will occur, is at what point does the infrastructure, whether it's the EHR, the e-prescribing, the core pieces of digital health, where do you draw the line and move beyond government into different types of business models? And if you look at Allscripts down in the US, where they created a hub, the private sector funds it, set it up, people buy into it and subscribe to it, and it exchanges drug information freely. And then you've brought in your vendor platforms, your payers, your providers, and then everybody participates in this ecosystem. That'll be very interesting to see how that happens in Canada. And where I think things will get very interesting is when you start to get these, you get that critical mass of data, you start to link it through to channels like what Sanjay has demonstrated, where I am a diabetic. My diagnosis is in my PHR. What does that mean for me? Sure, I can have a better dialogue with my physician, but if you look at where Google made its money, it wasn't around search. It was tailoring advertising and specific messaging around a search that you did. At what point does that tagging of you being a diabetic lead to you getting better information, connecting up with people in similar situations, and really making an impact on your care?
I think that's a great point. I mean, the way I look at monetizing content is the content is the starting point. I think the second piece you have to do is solve a problem. And I think the third thing you have to do is look at the distribution channels. So, for instance, as we roll out our iPad platforms, what we're trying to do is the pitch is to the doctor to increase efficiency, to increase throughput. So that's a business goal from their standpoint. And so the more that you can solve a problem for someone who's integral in the system, whether it's a physician, whether it's a hospital administrator, whether it's a government, I think that's the key to solving and where emerging business models are going to arise from.
Great, thank you. Maybe we'll move a little bit into some of the enabling areas, which is the role of regulatory and regulatory agencies in this adoption of digital health. We know that that this can and will create significant changes to how, who, and what information people are accessing, and how healthcare and treatment decisions are made. And the question that comes from that, if you look at some of the new regulations that are coming out with the definition of software as Class 2 and how far it goes into a Class 1 medical device, is what is the role of the regulatory bodies, and what role should they play in this emerging system? And maybe Zach, we'll ask you to start this one.
So when it comes to regulatory bodies, I think there's really two things to think about. One is, sure, like as you mentioned, the classification of devices, and a regulatory body that can somehow certify that those devices are safe. I think that's an important role that we need, especially for consumers who don't necessarily have the wherewithal or the resources to do the due diligence on everything that's freely available in retail stores. So I think that there is some value, much like a CSA or some other governing body that does create criteria around new and emerging tools, devices, solutions that give the public a sense of comfort that these are safe. I think that there's you have to be very careful though, because the certification process or the hoops that you have to go through with that regulatory bottle can't be onerous. They can't because they really do have the prospect of stifling innovation, and the costs, processes, entrepreneurs don't have the resources that large companies often do, and I think a lot of the innovation comes from new products and solutions and technology that come out to the market. So these certification processes, the regulations around them, while very important, and I think they're important for the safety of Canadians, I'd hate to see process play a role in stifling innovation. So I think that's kind of one viewpoint around the safety of these solutions. The other is regulation, more from a policy perspective. So I talked about the changing roles of consumers. That I think from a policy perspective, we also have to be open to new models of care. So we need to acknowledge from a regulatory perspective as well as a policy perspective, and to some extent government, that physicians should get paid for more than just the 7-minute visit where you come into their office and sit down. They're going to start interacting with patients in a much more innovative, much more efficient, much more effective way. And I think not acknowledging that is going to also stifle the innovation and the adoption of a lot of the tools that ultimately are going to help health outcomes.
Any questions from the audience? Please.
Sam, try to go to one of the,
To the
mics
mics.
that are around so we can hear you. Yes.
This is wonderful. Thank you very much. My name is Kathy Kastner. I am an entrepreneur. I have a television network in hospitals all across Canada. And I think the notion of repositioning EHR, PHR is essential in the spirit of Pfizer repositioning drugs as, or the pharmaceutical industry. But my question here relates to us having access to, us being consumers, having access to all of our information. And yet, from our surveys with patients in the hospital, we don't necessarily understand the lab reports, the lab results, the medical jargon. So I know we're developing, as our company, we're developing a translational device even for simple words like gait and stool, you know, that can be contextually can be confusing. And I'm wondering what the thoughts are on determining what consumers do and don't understand about their health records or about their health results that can be helped through technology.
It's an interesting question because I'd be curious to know how many people have gone and seen a physician, actually asked to see a lab test that they've gotten and looked at it and said, what on earth does all this mean? It's a very, very interesting question. So there was a great article on this, I think it was 2 months ago in Wired magazine, and they actually did a little bit of an experiment. And they went out and they actually had a design firm take a look at lab tests and redesign how the results are presented to patients. So instead of, well, okay, you have a CBC of X, it is, this is what this is what this blood tests mean, and here are some potential, I'm going to say, recommendations or findings that are associated with that blood test. It's a slippery slope too, because when you start to do, you know, when I was involved in e-health, the whole thing of normalization came out, which is how do you change terms to make them pertinent to consumers? How do you make terminology and values the same? And at that point, you're starting to change data, which causes a bit of a chain of information problem. I don't think it's insurmountable, but if you're going to engage people, they got to understand what it is that they're looking at. And one of the biggest problems is you get a lab test done in the west end of Toronto, you get one done here in downtown Toronto, they could be using different equipment. So you go and you talk to somebody and you say, I got a 6.8. Oh my goodness, I got a 9. They could both be within the normal range, and both people could be okay, but they don't get that, and that doesn't come with the information.
So we talked a lot about optimization of utilization of our healthcare resources, but it sounds to me that, you know, as consumers get access to more information, they're probably more likely to have more questions and would want to go to their doctor and understand better what is it they're looking at. So if we take analogy from financial industry that, you know, we all do our e-trading and manage our bank accounts online, this do-it-yourself medicine probably is unlikely to happen just because it's so complicated. Sanjay?
Yeah, I would also answer that as a physician. So there certainly is a supply side problem in terms of the number of physicians who can deliver care in an efficient manner as it is. And so if any given visit increases by 20 or 30%, you know, through some of these things that we're talking about, you actually are driving towards a much less efficient system. So that certainly is a concern. And I know while, you know, the horse is sort of out of the gate in a sense, I mean, we certainly need to work out a lot of these bugs as to how many questions, you know, is realistic in any given patient-physician interaction.
Sam?
Yeah, my name's Dr. Sam Ozerski. I'm a psychiatrist and an entrepreneur. I won't say budding because I really don't know at what stage we're at. But I would like to make a few comments. Consumers are usually nice people. They're really, I can't say anything bad about them except they don't take their medications. They don't like paying for things. And even if you bring them the best arguments that they should change their behaviors for the sake of their health, they'll rarely do it, despite all of the pious talk about how you can become well. The only examples that I've ever seen, first of all, I've never seen an example of a consumer paying anything for digitally delivered health care information. I've only seen one example of consumers changing their behavior in a dramatic way when you actually pay them to do it, like Aetna has. Aetna has a unique model of putting money, paying people cash in their health spending accounts, and they've actually found that consumers, if you pay them $500 to stop smoking, they will, and in the long run, it's worth it. So I think we have to be very careful about making all kinds of assumptions about consumers paying for things or actually changing behaviors unless you pay them.
Can I comment on
Please.
that? I think too we also have to look at different stakeholders, and there's opportunities also with employers, with stress being a big issue, smoking. There's a lot of things on the employer side where they would like to decrease their employee absenteeism, increase productivity. So I think also looking at the employer as a customer is beneficial.
Maybe a different perspective. I'm not in this field. I'm an immigration lawyer, and I'm doing a master's at the Faculty of Information, so it's a bit of a career shift that I'm on. One thing I didn't hear anybody talk about, we've talked about consumer, but in terms of statistics, for example, Toronto, the estimates are in terms of the changing face of Toronto, in terms of immigration, different language abilities, different cultural realities of consumers in the health field. I'm wondering if there's been any thoughts about how to deliver perhaps in, I don't know, different languages, or how to do, I guess, effective outreach, or how would the outreach look where you've got newly arrived immigrants who are going to be consumers of health here, want to keep them healthy longer, obviously, in terms of costs. So I don't know, just sort of throwing it out there, it just seems something that was, we talk about consumer, it's like we assume sort of a kind of a homogenous sort of, and not that immigrants don't speak English, but again, there's cultural and sort of, you know, some maybe, the lady that was talking about translation terms that might not be, even for born Canadians, medical terms might not be understandable. So those are my question, comment, or...
I have a thought around it. We've gone to some pretty extensive lengths to ensure that the solutions that we're deploying are very intuitive, very simple, very clean. They support the TELUS brand, but outside of that, they really do encourage adoption, because I think you're right. If you make accessible a bunch of information in a very convoluted, complex fashion, it's tough for people to interpret. Never mind just the terminology, but just navigating through a really complex website is not too dissimilar from navigating through a complex bureaucracy. So I think we're considering that. The second half of that becomes more of a marketing question, and TELUS has traditionally had a fairly strong marketing effort in multicultural segments. Until now, that's been around cell phones, but we're going to start to see a lot of our marketing muscle shift or to expand to include some of our consumer health offerings as well.
So just to follow on that, there's the accessibility, making sure that everybody in their preference manner can access it. The other side to this is the consistency and accuracy of the information being provided online. And who is responsible for that? Is it buyer beware, or is it really, is there some role? In the US, there's a foundation called Health on the Net that is kind of like an ISO certification that is providing a validation. If you go to the Mayo Clinic and a few of the other ones, you'll see the Health on the Net stamp of approval, meaning that they have investigated them and that they have the proper business processes and sources of information to make them a credible supplier of information. So the question to the panel members is, how do you see this rolling out in Canada, and is there a role for a Canadian Health on the Net?
I can certainly start off by answering that. As we, our core competence is creating content. I think it's critically important. It's amazing how patients take these data and start to internalize them and influence their care. So there's no doubt in my mind that there should be some, whether it's an ISO-related function. Obviously Insider Medicine's core area, the way we've approached it is as an editorial board. And these are some of the things that we have an ongoing discussion, on a day-to-day basis as to what we're going to cover, how we're going to do it. Are there meta-analyses, are there systematic reviews, as opposed to just one isolated paper. So I think it's critical because people are looking to these things and they're making very quick judgments based on it.
So is it a fundamental part of your marketing that the information on Insider Medicine is evidence-based and that's what you're created by doctors?
Absolutely. It's a team of doctors, biostatisticians and clinical epidemiologists who look at it.
So do we have another question?
Just thanks first to the MaRS group because it's a hugely informative session. Anything on market insights is. My name's Sarah Brown. I worked most recently with one of the national pharma chains on a rebrand initiative that sort of launched in some concept stores. And my question is actually for Dr. Sharma. I'm just interested in the B2B Twitter and Facebook and how that has been as sort of social media, how successful that's been, and what is the key driver to the YouTube channel. Just any sort of insight around that as a marketing channel.
Yeah, that's a great question. I wish that we've created a multivariable model that could definitively say what variable drives a particular video. It's hard to know. Is to be honest with you, in terms of the short answer. I think certainly there are a number of search terms. If you look at what search, whether it's diseases or whether it's therapies, that are a driver. My second guess is there's a certain demographic that may be a little bit younger, and so a condition like retinitis pigmentosa, the prevalence is quite low, but the demographic is 15 to 25. And that seems to be important in terms of driving views. Twitter, I don't see as much influence just based on the number of characters that are used. But I think certainly Facebook is an absolute behemoth in terms of what it could be in terms of a web health application for sure.
I think it also would be maybe useful to revisit a little bit the regulatory question because we talked a lot about content, but there's also the whole stream of data that's now available to consumers through various monitoring devices. And we're sort of starting to look into the future now where diagnosis decision and treatment decisions are based on this stream of data. And so Health Canada came out with recommendations early December last year. We know it's an evolving landscape. But I'd be interested in sort of panel's view also. How do you see the role of regulatory agencies in terms of enabling or slowing down this market?
Overregulation can kill.
Okay.
There's a lot of reasons behind that. Is obviously medical devices and the fact that they're an interface in many cases with treatments, medications, and us as patients. I think that's an appropriate level of regulation to have. But I've also seen examples where too much actually hinders an organization. And in many cases, it's driven by an event or an issue. The hammer comes out, overregulation gets put in place, and then that organization loses a lot of agility and capability to innovate, which is unfortunate. So it's not a very easy question to answer. One example goes back to, I was working with Canadian Blood Services, and you needed 3 people from Health Canada to come in and change a memory board on a computer. And that just killed them. It made it very hard for them to do anything. But they were also coming off of a scandal. What I think we need to do is look at what might be some certification and auditing services. We were talking a little bit about this in the back about what would be a better business bureau for health information, right, or a CSA. And you don't want it to be too intrusive. You don't want it to be too burdensome, but you do want to be able to say that there is a minimum standard that has been met by this person who's either going to be seeing your health information or storing your health information. And it can grow out of there. More invasive things such as research, clinical studies, clinical trials may warrant different levels of certification. But you don't want to jump too far on over regulation. I think it's a graduated and I'm going to say evolutionary way to get there.
Does Pfizer have a view on that as a company that lives by regulations?
Well, I agree. There has to be some type of business processes and, some type of ISO certification or something that would that people would have to go through, but it would allow actually everyone to be on a level playing field.
I think too it's important because there are a number of regulatory organizations in Canada that they somehow need to coordinate amongst themselves. Health Canada announcing their consideration of consumer health applications as a Class 2 device. Canada Health Infoway coming out with a certification program around consumer health applications. I think they just need to get together and have a common view, because like I said, some of the smaller, more innovative companies just aren't going to have the resources and the money to navigate multiple regulatory processes.
And I think if they do get involved, it should be on specific fronts. So I think it should be around the encryption technology for the safety of the databases, and probably the threshold, using sort of a Six Sigma analogy, the threshold, should be that much higher in terms of the safety of the data.
Any other questions from the audience?
Just a quick question. We didn't touch on physicians' roles too much this morning. How do you think that's going to really change with this personal health record?
I guess all eyes are on me for this.
All eyes on Sanjay.
I see physicians obviously as a critical piece to this. No matter how much we say Health 2.0, no matter how much we talk about physician empowerment, at the end of the day, the physician is the one who writes the scripts, the physician is the one who does the procedure, the physician is the one who orders the diagnostic tests. So unless you get a buy-in from physicians, the vast majority of businesses, the vast majority of business models just won't survive. So part of the way Insider Medicine's approached it is to really get buy-in. And so, active discussions with the Canadian Medical Association, active discussions with physicians themselves to say, what sort of problems do you have? How can we potentially solve your problems? Whether it's through informed consent, whether it's through creating, websites that patients can go to, but they're anchored through the physician's offices. So I personally think it's a critical piece.
Do you see any differences in sort of rated adoption and appetite between Canada and US and kind of other parts of the world?
I do. I think I would cut it two different ways. I would say in the US, it's a much more, and I practiced in Philadelphia and Boston, it's a much more competitive marketplace. And so the pressures for earlier adoption is much greater. I would also say that demographically, physicians under the age of 45 are much more willing to experiment with, taking emails from patients, potentially using other emerging modalities to enter into the conversation with patients.
So I think we probably have time for maybe one more question, if anybody has one. Or we can kind of ask the
core questions. Well, I think it's quite obvious that we're at the forefront of a whole new wave of businesses, and that's very much the intent of MaRS Market Insights, is to open a dialogue on sort of a new topic. And it's clear to me from this morning discussion that there's a lot of interesting initiatives coming from all participants in the ecosystem, but there's also a lot of questions, and as Mike said, we'll have a solution by 2020, was it? Well, I'm a little more optimistic, but I expect that we'll have similar panels and sort of evolving dialogue over coming months. Krista?
Well, we just want to thank everybody for coming, and I think the panelists will be around for a few minutes for conversation, but thank you very much, and good luck with all your endeavors.